So thank you, Professor Ksenya, for inviting me here. What an honor this has been, just to be with all of you and hear of your work. And of course, Angela Davis, I can die now, right? In 2007, I moved to Philadelphia with 2 little boys because I got a scholarship to go to UPenn and get my PhD in history of nursing. Before that, I had a back that was disintegrating. I had ruptured a disc in my spine and needed spinal surgery. I was a very busy labor and delivery nurse, running up and down, delivering babies all day, and this was in South Carolina. So the epiphany for me was I needed to move my career in a way that I would not further damage my back, right? And so started teaching nursing board reviews, and I was told I had a gift in teaching, so I thought, okay, let me run with this. Went to visit family in Kensington, and they dropped me off on UPenn's campus. I walked out with a scholarship application. I didn't know UPenn was an Ivy League school. I kept thinking, my God, what beautiful buildings they have. It's really pretty. And 3 months later, I had the letter in the mail that I had been offered this opportunity. Okay, I had the opportunity to study Black Panthers and to understand through Alondra Nelson's work that the Black Panthers were not just what we visualize when we see or say the word Black Panther. They held health clinics, and they helped their communities by doing sickle cell screening and physical assessment in communities that were very impoverished. They utilized retired ambulances, which I think is incredibly cool, to get their health clinics mobilized so they could reach these folks. I learned about how the civil rights movement was the exemplar for the women's movement, for the women's health movement, for our environmental movement. The civil rights movement we owe so much to on so many different levels. And as a nurse, you're probably thinking, why is Linda caring about all this? Because I knew that infant mortality, infants dying before the age of 1, was a phenomena that is dreadful on all counts. To be with a woman who is delivering a baby that has passed away and to bear every contraction with her and be with her as she goes through this process that should be joyful at the end, bore on my soul. In addition, I witnessed many, many, many cases of medical racism, healthcare racism, which, if I'm not mistaken, Martin Luther King referred to as one of the worst forms of racism, is racism in healthcare. Here you see from 1982, the Philadelphia Inquirer, Philadelphia Census Tract 152 had almost three times, the rates of infants dying before the age of 1 compared to the US. No one was doing anything because these were poor Black women who didn't matter, poor Black and brown women. So these activists got together, and it was a lawyer, a nun, and a physician. It sounds like I'm getting ready to tell the joke that they all walked into the bar together. But they formed a coalition, and what they did was really, really unique in that they went to the community, which was North Philadelphia, Census Tract 152, and they found the trusted members of the community, perhaps older women, and they got them working together. So they raised a coalition. They did a grassroots collaborative effort. Well, that grassroots collaborative effort modeled right after the Black Panthers' use of retired ambulances, got buses called the Mom Mobile, gotta love it, right? And this brightly colored yellow bus would go through communities of women, perhaps young teenagers who suspected they might be pregnant, just talking to women, getting them involved in healthcare, getting them linked up to clinic services. They also went to the different hospital systems and looked at them to see how they were caring for poor people. And one of the hospital systems that's currently a big hospital system in Philadelphia was charging women $2,000 to come into their labor and delivery unit. Highly illegal. So my favorite part of my dissertation work was when I interviewed the nun who admitted to me that they all pretended to be pregnant, calling the hospitals for a clinic appointment. And I said, wait a minute, sister, you pretended to be pregnant. Mind is blown. Okay. When I came to Villanova, historians of nursing, we're not out there, we're not very marketable unless we move our skills into a direction that's more contemporary. So I did a 2-year postdoc and started to look at what was going on in the Puerto Rican community. Literally just sitting there one day in front of my computer thinking, how am I going to move my history project research into something contemporary? So I said, you know what, let me look at my people. Let me look at Puerto Rican people. What's going on with my people? Well, what I found out was of all Latina subgroups, Puerto Rican women have the poorest maternal infant outcomes. What? We don't have issues of documentation. We're not facing that. But to be honest with you, women who come from other countries, undocumented, have healthier mothers and babies than we were who live in this country without documentation, right? Made no sense. So I started a team of students and I interviewed 24 pregnant urban childbearing women in Kensington. And what I learned was that each of them, in addition to struggling financially, in addition to working those 2 and 3 jobs, had witnessed or lived on a block where there was a homicide. And I realized trauma. Trauma was at the heart of what we were seeing in the Puerto Rican community, and I would also stipulate that it's probably a huge contributor to what we're seeing in the Black community, because infants in the Black community have been dying before the age of 1 disproportionately high forever, and it's shameful in a country with so many resources that this is still happening. So I started to ask myself, what's going on in their lives? And my framework looked at their community, looked at their neighborhood. So guess what I did? I got in my car and I went in their neighborhood. Now, granted, I have family in Kensington. This is a typical home, a Puerto Rican home with the guardrails, very decorative, but that's to keep the bad people out. This was a field that I noticed children playing in. This is also a field where folks who are suffering from addiction travel through and leave behind heroin needles. This was a rally from a young woman who lost her partner. Who killed my daddy? The little boy's holding a sign. Kensington has pockets of some of the highest rates of homicide in the area. Philadelphia, highest rates of homicide right now. I think we're in the 430s. Students and I went to a park in Kensington and we worked with Prevention Point in cleaning up that park. We retrieved over 30 used heroin needles. The part that really shook me was that right in that park was a newly resurfaced playground area. Swings, you know, the things that kids climb and swing on and all that fun stuff, right next to this field with heroin needles. Prevention Point is a harm reduction service that I started to look into and perhaps get my students involved with. When I first approached Villanova College of Nursing about bringing students into Kensington, I was expecting, yeah, unitas caritas veritas, we're in, and I did from the dean, but then I started hearing rumblings from people who said, oh, but it's too dangerous. I said, excuse me? Kensington is in Philadelphia. We have students all over Philadelphia. Why is Kensington too dangerous? Well, it's just too dangerous. You know, it's those people with the drug addiction. I said, oh, okay, all right. They didn't know me very well. I brought in students into Kensington. We were successful. And this community health center that we're working with, we opened up a health clinic, and at Prevention Point, we started doing foot care for people suffering from homelessness, and many of them suffering from addiction. I'm looking for help from other departments. Doesn't have to be just nurses. I'm a firm believer that it takes a village, and the village has to have folks from different talents. So if you're interested, please email me. Thank you for listening.
It's so wonderful to be here at this important event with others who care about these issues so deeply and dedicate such effort to informing others, improving the lives of those in poverty, and addressing the underlying causes as well. I also really want to thank Stephanie, who I consider a dear friend. And I'm so glad that you put this together. And, I want to be you when I grow up. So I'm not the only person in this room who feels that way. By the way, we were all talking about it. So I've studied poverty and inequality in the United States for nearly 25 years. I teach courses on these topics, and I wrote a book about poverty. I care about the people I've studied, the students I teach, and the ways in which I might help move the needle to ameliorate the worst consequences of dire poverty. So today, I want to discuss what the title of this panel has been inspiring me to think about more explicitly, the role of academia in anti-poverty work. And as I've thought a lot about the role, I've also thought a lot about the responsibilities that come with that role. So my job as a faculty member is multifaceted. I teach, I do a fair amount of administrative work, also known as service, for my department, university, profession, and I do research and I publish work based on my research. My book, Surviving Poverty, Creating Sustainable Ties Among the Poor, used in-depth interviews with poor people in Philadelphia to explore how they survived and the benefits they gained by being connected to one another. Half of the study participants were members of the Kensington Welfare Rights Union, or KWRU, now known as the Poor People's Economic Human Rights Campaign, or PPERC is their acronym. The mutually supportive relationships the members created, which lasted for years, even decades, contrasted dramatically with the experiences of participants who were not members of the group. I found what I call sustainable ties, non-family ties that can last for decades between people poor enough that most had experienced homelessness. Poor people are often socially isolated due to structural inequality, yet they often also avoid potentially valuable ties for varied reasons. In particular, the notion that you should be self-reliant is pervasive in American society. Increasing neoliberalization over the past several decades has only made it more so. This individualism leads poor people to try to avoid social ties and, in their words, stay to themselves. They aren't always able to avoid social ties, but they often wish they could. But great need did bring some people to overcome these obstacles and seek help at an organization that promised help. Reciprocity requirements made the cost of social ties very high, but they also came with great benefit. And ultimately, the sustainable ties KWRU provided made members' lives better. This and all the other photos I'll show are by Harvey Finkel, the photographer who has been following the organization I studied for years. I think he's with us on Zoom. Hi, Harvey. They are not of the people that I'll quote, but they show people who face struggles, but who are more than their struggles. So as I said, I interviewed 25 members of the Kensington Welfare Rights Union, 25 non-members. Everybody was very poor. KWRU and PPERC were founded by poor people 30 years ago in Philadelphia. It's dedicated to raising awareness of the perspectives and experiences of poor people. Its ultimate goal is ending poverty, but it also supports members' day-to-day survival. It holds regular demonstrations making a case for poverty alleviation and destigmatization. Members have received housing vouchers from the city because of these protests. In KWRU, people who had generally avoided social ties stopped avoiding them. They weren't trying to build ties. They were trying to avoid living on the streets or having their utilities shut off, or they were trying to get custody of their kids from an abusive ex-partner. But their vulnerability made them open to building ties, and the process of getting help from KWRU led them to develop productive social ties and to keep them. So I used my book to share their stories. A member for nearly 10 years at the time, Becky told me, if anything goes wrong in my life, it's KWRU. To me, they have become my family. They became my life. A person feels as though you don't know where to turn, and you're backed up against the wall, and you have nothing, and you have children to take care of, and your health is not that great. And along comes an organization that says, look, I will teach you step by step how to get your life situated. Becky's feelings about KWRU even exceeded the kind of connection most people have with their own families. KWRU helped her at times of real desperation in ways she found both valuable and rare. KWRU as an organization also actively encouraged relationships between members. So Walter, a group leader, told me, get them to know that they're not crying alone, and so they tell their stories to each other. What's your story? What problems are you having? What does that say? Not only do I want to acknowledge you, but it says I care. This created a climate in which people established trusting, supportive ties with one another that could last for years. So I did in-depth interviews and participant observation. I spent time at the KWRU office helping out, socializing with members in the waiting room. I accompanied members on errands, and I attended and participated in rallies and protests. For most participants, I'll just talk louder now. I also went to their homes or another place of their choosing multiple times to conduct interviews. This map of Philadelphia from the Cartographic Modeling Lab at the University of Pennsylvania splits Philadelphia into 69 neighborhoods. It brought me to the next animation, so there was a zoomed out view, and this is the zoomed in view. So this is the darker the green, the higher the rate of poverty in the neighborhood, and this box is the detailed view, represents where I conducted most of my participant observation and interviews and where most of my participants lived, so really all over, allowing me quite a bit of variety in participant geography, as well as some variety in neighborhood poverty rates. But people from KWRU didn't just live in Kensington. Many did live in the neighborhoods near the office, but they really did live all over. In interviews, participants discussed their struggles and their hardships, and their responses highlighted the importance of cultivating relationships among people living in poverty. For many people, social ties did become beneficial and sustainable, allowing members to share their skills and resources and providing those living in similar situations a space to unite and speak collectively to the growing and deepening poverty in the US. Many KWRU members specifically asked that I refer to them in my book by their real names, but professional concerns prevented me from being able to do so, and practically speaking, because membership was so interconnected, disclosing one person's identity could feasibly end up disclosing another's inadvertently. But participants are justly proud of their words and their stories, and they seek refuge from the invisibility that characterizes the lives and ideas of the poor most of the time. KWRU activists frequently mention that they have been invisible for so long. They shared hopes that maybe this book would help them be less obscured. So I hope that by telling their stories, I have fulfilled their desires in part. In doing the research, I foregrounded the experiences of those I spoke with. I've always found fascinating the way people understand their own situations, whether they're poor or not, how they make meaning, how they cope with struggles. But in all my work, I also strive to avoid one potential ethnographic fallacy that views the truths apprehended as if they are the whole story, stripped of context, that considers larger structural systemic forces that shape the very existence of the difficulties people confront, and what options are available to them to cope with the dire consequences of bad situations. So we need to do research on tough questions and report our findings honestly. We need to do research in neighborhoods people who have never set foot in call dangerous, and talk about it, and be honest about the hazards we confront, but always put them in a larger context, and share the safety we often feel in such neighborhoods. For the research for my book, I took public transit all over Philadelphia, alone, in daylight, at times after dark, and I never felt unsafe, and I never encountered a threat to my safety. This does not mean all fear is unfounded, but blanket assumptions about stigmatized neighborhoods and the marginalized people who live in them are neither useful nor fair. We have a responsibility to teach truthfully and holistically to our students. We all have the responsibility to be like Stephanie. If anybody has ever been in her class, I know there's some of you, or had the pleasure to have her give a guest lecture to your students, there's no way I could even follow it, but you need to come again. So especially as someone who teaches in the poorest city in America, Camden, New Jersey, and lives in the poorest big city, Philadelphia, I have a responsibility to bring students outside of the classroom to the real world, to help them debunk stereotypes, to challenge their misperceptions. But I seek to do this with grace and compassion. I seek to meet them where they are, instead of berating them or scolding them, even when I hear well-worn negative stereotypes about people who have been marginalized and impoverished by policies that have enriched others. Rather than let students succumb to the two-dimensional picture of Camden as dangerous and unworthy of time and commitment, for 10 years, I've had my students in courses in urban sociology, housing and homelessness, inequality and poverty go out into Camden and work with middle school students in a variety of Camden after-school programs. It's all through Rutgers-Camden's Office of Civic Engagement. Rutgers-Camden takes seriously its role as an anchor institution through its commitment to what we call civic engagement. Some think of as service learning, which of course implies that students learn by completing service. We rename and think of as engaged civic learning. Students learn through engagement, but we see it as a partnership with community members. We don't approach the community and say, we will provide this service to you. Instead, we say, how can we be of help? How can we leverage our resources? What would you like from us? And the learning is mutual and the assistance is reciprocal. We need to bring the stories of poor people and amplify their voices to our students. But we also need to avoid the ethnographic fallacy to make sure that context is recognized and we're making the invisible social structure invisible. We have to disseminate the knowledge we develop in ways that poor people and people who can make policy decisions get that knowledge. In academia, faculty are under immense pressure to publish in venues that tenure and promotion metrics highly value. But when we only publish in scholarly journals, we limit the reach of our work. This is an even bigger problem for journal articles that live behind paywalls, only open to people with institutional affiliations that allow them access. There are some ways to work within this system and disseminate research. We can do open access articles, and there are more opportunities in reputable journals to do this than ever before. But in most cases, we can also make available penultimate versions of articles without violating any embargoes or copyright restrictions. Beyond journal articles, we can and do write books, which can take more time but end up being more widely read. And we can also join organizations like the Scholars Strategy Network, which I am a proud member, an organization of scholars that connect our research to legislators, civic organizations, and the media. SSN members write briefs on basic facts and key findings that help the public know more about our work. We can also write op-eds. Now, a lot of people in academia are precariously employed. We heard before about adjuncts. Staking a controversial position in a public forum can be scary, and even something some people cannot do in order to protect their jobs and therefore have a longer-term impact as a result. But I have tenure, and I have responsibilities that come with that privilege, which include teaching my students the whole truth, even when it's controversial, speaking to reporters when called to weigh in on an important issue that I can speak to as a trained expert, and publishing op-eds. Speaking of privilege, we can leverage our privilege. If a neighborhood feels dangerous, instead of using that fear to avoid the neighborhood, use it to advocate for safety for those who live there. If you think your local public school is subpar, advocate to make it better. In our research, if we profit financially from it, we can give that money to the people we study, if at all possible. Or, if you make a lot of money on those books, create trusts or foundations to aid them. I give all royalties from my book, even though it isn't much, about 84 cents a copy, to PPERC. And we can help as possible in other ways, with our social capital, with our moral support, with our bodies at rallies, our credibility in publishing in respected newspapers. Above all, our responsibility is to amplify the voices of poor people, give them opportunities to speak to our students, to co-author with us if they want to co-present at conferences if they want to. We need to shine a light on people's struggles, but we also need to move beyond description of tragic experiences to show the full lives of people in poverty, not just the tragedies, the love, the warmth, the challenges, the joy, the friendships, and so much more. So often, scholars who study poverty focus on people's material needs and economic hardships, but it means that attention to emotional needs gets lost. Beyond their potential usefulness in dealing with the material conditions of poverty, social ties can provide emotional support and a sense of community that makes people's lives better and gives them a sense that they're neither alone in their struggles nor alone in the world. We should care about that as researchers, for it is a fruitful area for exploration, and as people, because the poor among us have humanity as well, and recognizing their need for connections that abate loneliness acknowledges that humanity. We also need to move beyond descriptions of tragic experiences to engage with broader causes and consequences, to talk about how we can truly move the needle to change the way the system works, to disadvantage so many while benefiting so few. One person I interviewed for Surviving Poverty, Walter, who I mentioned earlier, told me he values being out there and realizing that my crying is not a cry by itself. There's other people crying too. And by putting myself in relationship to other people, I gather strength. There's no way that we can exist without each other. And I feel the same way. So thank you all for being here today for these important conversations.
Good afternoon, everybody. You all are what we would call the remnant. You are hanging on, and we are grateful. I want to say thank you to Stephanie and to all of those who had a hand in making this day happen. I want to situate myself in this conversation. I want to tell you a little bit more about who I am. I am Naomi. I am Naomi's granddaughter. I am Detroit's daughter. I am a child of the historically Black church. I am a Black woman who is married to another Black woman. I am mothering a Black girl child. I am a preacher, a teacher, an activist, a singer, a troublemaker. And I'm holy. And you're holy, if you didn't know. I am, as has been said, the director for faith-based and interfaith affairs in the mayor's office for this great city, or the great city of Philadelphia. And in that role, I serve as the liaison to the many diverse faith communities in the city. Over the last year, I have been City Hall's primary advisor on COVID guidance and messaging for houses of worship. And I am an adjunct here at Villanova in the Theology and Religious Studies department. I teach a variety of undergrad courses, including two that I designed. One is called Do Black Lives Matter to God? A theological exploration of race, suffering, and resistance. The other is called Agitating for Justice, Faith-Rooted Community Organizing. And I will proudly say that I was honored with an award for my teaching here at Villanova in 2019. I'm one of the multi-faith advisors here in campus ministry, so I've preached over there in St. Thomas of Villanova Church. I direct the Villanova Gospel Choir. I sing with a group called the Philadelphia Threshold Singers. We bring audible kindness and comfort to those who are in hospice care. We sing at the bedsides. We sing people on over. I can tell you about how my work has been featured in TV programs and radio shows and podcasts and print publications. I can tell you about the elite spaces that I've spoken in and the urban spaces I've spoken in. I've had many titles and opportunities, but the opportunity that means the most to me, the identity that animates all of my work, is the invitation to be what my shirt proclaims, an untenured radical. Because I don't belong. I don't fit in. I write and proclaim a good news that is disorienting and perhaps even a little disappointing to people. I preach about the downward mobility of faith, the kind of risky faith that jeopardizes everything we've been told matters. popularity and prominence, prosperity. I am an untenured radical. That means I've made a commitment to eschew security and safety so that I can be free to do what I'm called to do, which is to try and organize and equip people of faith to respond to the crises of our time. And that leads me to the first point of consideration I'd like to offer to the Academy if we seek to help and not hurt the anti-poverty movement. For too long, the Academy has been invested in poor people and in poverty only to the extent that poverty and poor people keep us employed. That is, too often, poor communities are merely sites of academic investigation and analysis. Too often, poor people are reduced to subjects of scholarly gaze. Too often, poverty is treated like a befuddling problem that we need another study, another grant, another semester to understand fully. We are responsible. We're responsible for the ways that the Academy stalls radical action in the name of protracted academic inquiry. We're responsible. We're responsible for the ways in which the Academy will trot out those poor, unfortunate souls like exhibits on display. We are responsible for the ways we tightly prescribe the rules of engagement, such that our university and community partnerships are transactional and superficial and too brief. I remember when I was an undergraduate at the University of Pennsylvania, the first week we arrived, we were told by the person who was facilitating our time that we shouldn't go past 40th Street. Don't go past 40th Street. You want to stay above 40th Street. Coded, right? It signaled to us something about those people who live past 40th Street. We, the Academy, are responsible for investing millions of dollars in polishing our external image of veritas, unitas, and caritas, while at the same time underpaying and overworking Villanova employees and graduate students. Do we know the names of the people who serve our food? Do we know the names of the people who clean our offices and scrub our toilets? Do we know the names of the people who make this place go? We are responsible. We're responsible for the ways we require faculty to wait for tenure before saying and writing and teaching the boldest things. That poverty, as has been said before, is not an ontological condition. Poverty is an imposed condition. People are made poor. Bold things like universities like this one perpetuate poverty at worst and ignore poverty at best. Bold things like Jesus was not only concerned about people's spiritual health. Go back and read your Bibles. Jesus was revolutionizing people's economic health by denouncing the ways that the Roman state exploited the vulnerable poor, by telling people that they were indeed beloved by God, restoring their hope and their dignity, restoring their belief that they were fearfully and wonderfully made, and debunking the lies that the state told them about themselves. We are responsible. We're responsible for the ways that scholars are encouraged to be accountable to donors and grant makers and wealthy students and families, instead of to the communities that even made it possible for us to live a life of the mind. Detroit sent me to Penn, and so I am accountable to Detroit. Who are we writing for? Who are we teaching for? What are we doing? What would it mean for us to reward radicality in the academy? What would it mean for our vocational security to be connected to our sense of integrity and accountability and not productivity, not publish or perish? What would it mean to treat our adjuncts and our graduate students like we are not contingent, cheap labor, but instead necessary to the success of this university? My students don't know that I'm an adjunct. They don't know that I get paid substandard wage. They don't know that I don't have an office or a shelf or a drawer to put stuff in. They know me as their professor, and I should be honored for that. It's already been said. We know that contingent labor, adjunct labor, accounts for 73% of university teaching positions in the United States. 73%. What if the goal was to be called an untenured radical? What if higher education rewarded untenured radicality? What if imagination was our metric and not only empirical data, what we can prove and show and demonstrate? As has been said, joy is currency, joy is data. The second point I want to offer is that the academy must demand and support the work of deepening anti-poverty pedagogical practice in every classroom. Every classroom. The syllabus, I believe, is a political document. Let me say that again. The syllabus is a political document. The syllabus is a reflection of our investments, our priorities, our values. Poor communities have an intellectual heritage. Are our students reading the work of poor folks? Are we cultivating pity for poor folks in our classrooms? Are we cultivating a kind of voyeuristic consumption of poor people's pain in our classrooms? Do we consider how our disciplines have bolstered narratives about poverty that feed the status quo machine? Do we consider the impact of our curriculum or just of our general classroom management, our classroom practices on poor students? Do we require students to incur exorbitant expenses to do well in our courses? These are the questions we must ask every single semester, every single year. The third and final point, I'm a preacher, you know I got 3 points. The third and final point I want to make is that we have to investigate our theology related to poverty. And I feel like I can have that conversation here at Villanova in particular. I believe that all systems of oppression are sustained through moral justification. We don't have chattel slavery unless it was first sanctioned by God. We don't have Jim Crow. We don't have segregation. We don't have religious exemptions that allow people to discriminate against queer folk without religious sanction. And I believe that poverty has been sanctioned religiously. We believe that poverty is piety. The poorer you are, the closer to God you are. People then stay right there in their situations because they've been told that poverty is next to godliness. But then we also believe that poverty is sinful. Then we also believe that if you're poor, you're not faithful enough, that faith brings prosperity. These theological conclusions are as harmful as they are incoherent. They don't make sense together, but they live and thrive together. And that's just what we believe about poor people. We also have some beliefs about ourselves, those of us who are fighting to eradicate poverty. We often do this work to demonstrate and affirm our own goodness. We figure that there are good, wealthy people, good, wealthy institutions. Well, good is actually of no consequence here. There are no good people or institutions. I may not be invited back, but that's okay. There are no good people or good institutions. Goodness is not of consequence here. There are only anti-poverty and anti-racist people and institutions. The end goal is not for us to believe that we are good. The end goal is for our society to be just. The end goal is not goodness. The end goal is justice. The question is not, are we good? The question is, are we just? I want to read a letter, a statement that I received from the Poor People's Economic Human Rights Campaign, or the Poor People's Army. This is the organization that we just heard about, because I want to center the voice of an organization that has boots on the ground doing anti-poverty work, poor people organizing themselves. Before I read that, I want to, as a kind of blessing and benediction, read some excerpts of a poem that motivates my own work and life. It is called Be Nobody's Darling by Alice Walker. Be nobody's darling. Be an outcast. Take the contradictions of your life and wrap around you like a shawl to parry stones to keep you warm. Watch the people succumb to madness with ample cheer. Let them look askance at you, and you askance reply. Be an outcast. Be pleased to walk alone, uncool, or line the crowded riverbeds with other impetuous fools. Be nobody's darling. Be an outcast, qualified to live among your dead. That's the call if we want to be successful in this work. And here's the letter. To the attendees at the Anti-Poverty Symposium at Villanova University, on behalf of the Poor People's Economic Human Rights Campaign, Poor People's Army, we hope that you have a very successful meeting today, and we hope you come away with a renewed focus on ending poverty as this country staggers through the current deadly pandemic with approximately 45.2 million cases and approximately 729,000 deaths here in the U.S. While millions of families are facing homelessness, while millions have lost their jobs or had their work hours reduced, while childcare is much harder to get and the opioid crisis continues, yet other workers are fighting for higher wages, for unions, safer working conditions, better quality health benefits, and Medicare for all. We of the Poor People's Economic Human Rights Campaign, Poor People's Army, have been in the trenches, doing grassroots community organizing and political education with, for, and among poor and working class people, the homeless, the addicted, for more than 30 years in the Kensington area of Philadelphia, a mere 25-minute drive from this beautiful campus. The people we've organized with and for are of all races, genders, and socioeconomic backgrounds. Yes, we have seen in real time how people can be just one paycheck or one car accident away from being homeless. As many of you know, in the city of Philadelphia, the housing crisis is steadily getting worse. Millions of dollars are poured into various programs, yet people are still becoming homeless and politicians still make unholy alliances with developers. One of our researchers recently found that there are 10 unoccupied housing units for every one houseless person in Philadelphia. In the coming months, with the end of the moratorium on evictions, with the end of pandemic unemployment assistance, millions of families will face homelessness at a time when the government says it supports housing as a human right. Thus, in a time when more and more families struggle to find safe, affordable housing, we strongly believe that all abandoned HUD properties should be turned into homes or takeover houses, and we've done that for the past several months. We've asked ourselves many times, why does HUD have so many abandoned houses that families could be living in? We of the Poor People's Economic Rights, Human Rights Campaign, Poor People's Army, and several individual families in these takeover houses filed lawsuits earlier this summer against HUD. These families, including many with disabilities, are housing themselves in this way because of the lack of affordable housing. There are record temperatures in winter and summer, and homeless families risk child separation by child welfare agencies. We felt we had to sue the federal government because although the Biden administration says they want to end homelessness, right now as we speak, they are actively pursuing evictions against families in these takeover houses. But we've been very fortunate. These families have worked together with many in the community that have carpentry and landscaping and electrical and plumbing and drywall and other building trades to make these abandoned HUD homes into real homes for families that need them. The families are now residents and not trespassers. However, we should also add we've been arrested hundreds of times for nonviolent civil disobedience to try to affirm that housing is a human right. We have continuously cited international law, such as the Universal Declaration of Human Rights, and the U.S.'s own McKinney-Vento Act that allows for, quote, the use of unutilized and underutilized public buildings and real property to assist the homeless. So as you conclude this anti-poverty symposium today, we humbly ask that you keep us, the Poor People's Economic Human Rights Campaign, Poor People's Army, in mind for other events like this in the future. Invite us to be on your panels. Invite our researchers to share their findings. Invite our artists to share their courageous artistic visions. Invite families that have suffered homelessness and or those who live in takeover houses to share with you their experience in turning an abandoned HUD house into a home where families can live safely and with dignity. Please reach out to us. The number is 215-869-4753, or go to their website, poorpeoplesarmy.com. Thank you very much for listening, and we hope you will engage us in the very near future. Housing for All, signed Sherry Hunkala, National Organizer. The final words of my presentation are the words of poor people themselves. Thank you so much.
Hi, can everybody hear me okay? Cool. So my name is Ksenya. Let me see where I can start here. Thank you, first of all, to all the panelists of this panel that I am on, and I was deeply honored to be included in these conversations. Thank you very much to Stephanie for allowing me the deep opportunity to be a part of today and to come here and talk about the work that I'm involved in, that a team of EMS providers are involved in Delaware County. Also, when I talked to Stephanie, as a side note, I was excited about doing this. I thought maybe I could not wear a uniform for the first time in a while. And then we confirmed everything, and the hospital's like, you know what? Probably should wear your uniform. So that was a loss on my end. But anyway, so again, my name is Ksenya. I've been a paramedic for 20 years. I came to Philadelphia 11 years ago. I grew up in rural Pennsylvania. I've always been a provider. If anybody doesn't know, I'll give you a quick rundown of what a paramedic does. We provide medicine in very unorthodox situations. We basically bring critical care, advanced level care to your house, to the street, to your car, to anywhere, and try and bring the emergency department to you, bring a critical care unit to you, and in some small instances, reverse things that are gonna immediately kill you. It can be very stressful. It certainly takes its toll over the years, but it also is very meaningful work, and work that I think the profession itself suffers from not looking at it politically enough, not looking at it through a critical lens or critical thinking enough. So that's why I'm here today. We've started to do that at Delaware County Memorial Hospital. Our paramedic department started a community health outreach team about 1.5 years ago. Besides myself, I don't want to say I run the team, but I started the team. We have 6 providers, and we're comprised of EMTs, which provide more basic level care, paramedics that provide the advanced level care, and 1 pre-hospital registered nurse. We're overseen by our EMS medical director, Dr. Carroll, who's here today. Shout out to him for coming here. And basically, we take our care to the street in a community manner, in a social medicine manner. And I want to keep saying that and as much as I possibly can at this point, because for us in pre-hospital medicine, in pre-hospital emergency medicine, this is not a concept we've used enough. And we're using it now, and we're going to keep using it for as long as we can stay in existence to help people. Our primary service area is Upper Darby Township. If any of you know, it borders West Philadelphia. Often that border is blurred between what's Philadelphia, what's Delaware County. I don't know. I see the same patients. We have a heavily unhoused population, transient population, impoverished population in a very dense area. So we're a very busy service, and for decades, we've been looking at a public health crisis in the area of the 69th Street Terminal. If any of you are familiar with that area, it's a hub of transportation. It's a last stop on the L. It's a pipeline between Kensington and Upper Darby. And there has been a public health crisis ongoing on there for as long as I've worked at Delaware County Memorial, and for decades before then. I took it in, and where this started is I took it in. I took it in over a period of years. I looked at what the patients were going through, and I don't want to make this into a trauma sort of thing, like all we're gonna talk about is people's trauma, but it is valid to say from our point of view what we've seen as street providers over the years. In 10 plus years working for this department, the 69th Street Terminal has become a microcosm of a public health crisis and a need for social medicine intervention. I can't tell you how many patients I've pronounced in that place. I can't tell you the number of assaults, the number of sexual assaults, the number of homicides, attempted homicides. We're talking a transportation center. And one of the biggest things that we see there is the numbers of unhoused people and patients that we care for. Over the years, I've watched people in piles to stay warm through the terminal. I've watched them be forcibly removed by the police in multiple brutality cases where their heads were slammed against the wall. They were pushed out into the cold, only to butt up against the entrance, not to be denied access to a warm area. We've had people stuck to sidewalks because of hypothermia. I don't want to keep going on, but there was a point, and that breaking point for me after multiple attempts through a health system, and I want to say that our group is a group that speaks out It's complicated, but we speak out within the system. I know we're a part of the system, but we do speak out against the system. We raise awareness, we raise patient advocacy, and that's what brought us here to our current moment. What broke it for me is one night responding to 69th Street Terminal and having multiple patients that were emaciated. We had one patient who was running around having a mental health crisis who wasn't clothed. And I had a patient come up to me while we were caring for our psychiatric patient and say, you know, I'm starving, I haven't eaten for 3 or 4 days. Do you have any food on your truck? And I said, no, and I felt about this big. Because this was after multiple attempts through my supervisors to get something off the ground. And he said, well, you should, because people are dying and people are really suffering out here, and you can't keep coming down here and offering help and not bringing these things with you. It blew me away. It floored me. It hit me. My observation from that point was over. My clinical aspect was over. It came to the point where it completely switched me from that point on. I wasn't asking questions anymore. We were going to start this initiative, and that's what we started doing. This came without a lot of approval initially. We just started putting food on the trucks, blankets on the trucks, did our healthcare checks, make sure people weren't dying of hypothermia and starvation, because that's literally what they've been facing in this area and the surrounding streets. I want to present some of the challenges that we face as a team of providers. We at this point we provide weekly street clinics. We are outside in front of the 69th Street Terminal. We've tried repeatedly to get something, some shelter, some level where we can go in and see patients. That's been denied multiple times. We bring our vehicles down, we set up a table and chairs, and we see people on the street. We work with physicians, emergency medicine residents, nurse practitioners, and other paramedics or adjacent emergency providers. And we do what we can for them as we know how to provide medical care in the street. 911 has become, or has been in these areas, a complete last resort, and we take that last resort very seriously. If it's a last stop, as in, you know, it's an actual last stop for people being in the 69th Street Terminal, it's also a last resort. People have nothing, and they come to us and they look for help, and it's our responsibility to provide that help. Upper Darby, as I said, borders Philadelphia. There's a lot of boundaries and a lot of issues between who gets what services, either they're Philadelphia services, Delco services. We don't care. You're going to get care. You're going to get free medical care, and it's going to be done on a social medicine platform. I don't know if we should be saying this or not. We acquire our own medical equipment. We do what we can do from getting things from the hospital. We bring the resources that we need to the people that need it, and we listen to them. This didn't just start with, some sort of charity thing where, we realized that you're cold, and we sat and we worked for a long, long time to establish rapport, to get to know our patients, to get to know where they're coming from, to put their needs first, to fight for them, to advocate for them on every single level that we possibly can. And it shouldn't be rare in EMS departments for this to be happening. It shouldn't be rare in emergency medicine for this to be happening, but it still is. And we take exception to that. And we're trying to bring forth new points of care and new ways to keep our patient populations alive, to be honest with you. A lot of what we face, in addition to barriers and boundaries, is just medical. And I know this has been alluded to before, but institutionally, we're facing medical racism. We're facing phobic clinical providers. We're facing providers that are unaware of the challenges that their patients are going through. Again, this is why we keep calling this a social medicine initiative, combined with emergency medicine, combined with pre-hospital medicine, because that's exactly what it is. We have to look at the patient from what brought them there, for why they're there, the social determinants that are keeping them sick, that are keeping them well, and that are ultimately sometimes taking their lives. Our population, just to give you a quick rundown, we see typically smaller encampments, smaller communities, but in and around 69th Street Terminal and the surrounding streets. They often face a lot of displacement and harassment by the local police departments. A lot of our patients come from Black communities, brown communities, undocumented communities, LGBTQ communities, and that a lot of times that's the reason that they are facing the housing crisis and homelessness crisis that they're facing. In addition to that, and we also have a lot of impoverished or housing areas in Upper Darby that are facing healthcare issues due to lack of access to medication or proper care due to lack of insurance. So basically, how this ties into academics, I'm not an academic, I'm not. I barely graduated high school. So I think it was great to be put on an academic panel because I'm honored. But what I do have and what we can't look past is clinical experience. So 21, 22 years of clinical experience. I can tell you, without having the paper to it, that the job matters, what we do matters, and that our patients matter. And I think at this point, what we've done in creating social medicine and putting this team together, putting this, I hate to use the term outreach because it's got some bad connotations, but putting this community care team together, we've created something that's very unprecedented for our region. And I think the biggest thing that we've seen is that, again, I know this has been stated, but the numerous times that I've seen over the years of people just dying from highly preventable things. The number one thing that we do is wound care. And, this keeps people from becoming septic. This keeps people from pericarditis, a whole number of things that could kill them that wouldn't normally kill them because they simply can't clean a wound off. And it gets so infected they can lose limbs or they need surgery. And that's just one example of the care that we can provide that is also preventative medicine. And our last year, we faced a pandemic, we faced a brutal winter, and we faced it on the street with our patients. Yes, we have places to go back to that are warm. I understand the privilege in that, but we were out there with them through the entire winter. We lost some patients, but we kept way more alive, and I know for a fact that there are a number of patients that would have not made it through that winter with the unprecedented combination of a pandemic and just a brutal winter without our team's efforts. So in addition to our street clinic, we also do our efforts while we're on 911 duty. Upper Darby is a very busy area for our EMS service, so our providers are very dedicated, basically taking on 2 to 3 jobs at this point with providing 911 care and also providing the community care. I want to kind of wrap this up because I know we're close on time, and again, I'm very appreciative and honored to be here. Basically, I want to talk about, just to conclude this, 2 things. That we know these are basic needs, and we know this is extremely, extremely basic. So being able to keep your wound clean is very basic. Being able to know what your blood pressure is very basic. Being able to have access to the medication in case your blood pressure is high so you don't die of a stroke in your 30s is very basic. It's as basic as, I love physiological analogies, but it's as basic as your brainstem working to keep your heart beating, to keep you breathing every single second. It's just that basic. It's just that much of a vital and foundational right. And we see people all the time that are completely robbed of that right. And we see the effects of that. A patient told me the other night, just this past week at our street clinic, that it's bad enough to be unhoused, it's bad enough to not have anywhere to go. And we can't fight that fight. We're working, and I'm going to tie this into Stephanie and Villanova in a minute. We can't fight that fight. We don't have the resources to do that. We're not going to end homelessness. We're trying to keep people alive and healthy and going so they can get to the other services. That's where we come in with medical care. That's where we come in with our social medicine focus. So what he said was, being homeless is bad enough, but being sick and homeless is going to kill you, and it's going to kill you quickly. And that's what we're trying to prevent. That's what we're fighting against. That's what we're fighting for our patients to have that right, at least while they're out there in this insufferable conditions, to do whatever you can to get them medical care. We are entirely self-funded. So I don't know if any of you, and I'm going to get political because that's what I do. I don't know if any of you have read the Philadelphia Inquirer recently. Crozier Health System's up for sale. We don't know where we're going to be. And I know the individual I'm looking at that talked about Hahnemann. We don't know. Like, we have no idea. I think this concept in pre-hospital medicine will grow possibly beyond our health system because the need is there. But we have no idea what that's going to bring. We've worked for a for-profit corporation over the past several years that has robbed so much from us and allowing us not to take care of our patients. It's also just directly robbed the patients. So we haven't gotten any funding from them, not 1 cent. Our providers have paid for everything. The food, the clothing, the supplies, our time, our efforts. It's all self-funded. We've gotten one minimal donation and that's it. So that's what we're working off of. That's what we're facing. These are some of this is where I want to tie in the relation to academia is meeting Stephanie through our work with Upper Darby Township started a conversation that I didn't think our initiative would ever see. A paramedic and this just rock star lawyer talking about social medicine is not something I thought I would see in my career. And it's happening. And we're talking about our team partnering with the student-run emergency housing unit of Philadelphia and Villanova University to get this thing going further, to get it growing. And that's where the academic point comes to be. That's where the street work is given more life, because we're grasping for very little at this point, and it's not about us, it's for our patients. And that's the absolute key here. So again, that's something where I want to just tie this up. Sorry, I want to just tie this up where we've seen the violence of capitalism. And I want to be a paramedic that says that. I want to be a paramedic that stands up here and says that. We've watched the violence of capitalism. I've seen it. So we look at the 69th Street terminal. We've looked at the deaths. We looked at the poverty. We looked at the medical racism. We looked at everybody's seems to be generally okay with it until somebody starts saying something. And up until the point that we see the violence of capitalism in a for-profit, not in my career did I ever think I'd be working for a for-profit health structure. But we're fighting against that. Again, I don't know where this is going to end up. Stephanie and I are going to, I have high hopes are going to bring this in a different direction, and that's how all this tied in. The last thing I want to say is the way we did this was not asking any questions. We're not asking for favors anymore. I've done a lot of things going around, a lot of supervisors doing just exactly what I need to do so that people can get the care that they need. We're not asking from those structures anymore. We're asking, if anything, for these solidified partnerships with people like Stephanie, with Villanova, with the student-run emergency housing unit of Philadelphia for our patients. And I think these types of partnerships will allow this social medicine initiative, this street medicine initiative to grow. And I'm very appreciative for that. And I'm hopeful that we will see a very different program in the next 6 to 9 months. I do have really cool handouts that we made. If anybody is interested in what we do, it describes our team. I'll be happy to hand them out to you. Thank you so much for this time. I'm very appreciative.